As a diabetic, do you really understand what diabetes can do to your body? Most people don't understand it properly, and doctors can't explain it all in one sitting. Even if your doctor explains everything, the chances are diabetes makes us forget most of it. So today I will explain how diabetes affects your body. I have also added the top 5 special and simple steps to reverse the deadly onslaught of diabetes on our bodies. I have also added an extra tip in the end, and the doctor will never tell you about this. So stick around because this video can prove to be a once-in-a-lifetime opportunity for you to understand the diabetic complications you might face in the near future. This way, you will understand why the tips I have mentioned here can seriously alter the path of your diabetic life. So let's begin. To understand the diabetic complications, we need to first look at how they develop and what causes them. Cardiovascular disease is one of the most significant concerns for people with diabetes. Individuals with diabetes are 2 to 4 times more likely to die from cardiovascular disease compared to those without diabetes. In 2022, coronary heart disease, the most common type of heart disease, resulted in 371,506 deaths in the U.S. So this is the most important issue to understand first. When blood sugar is consistently high, it leads to a process called glycation, where sugar molecules attach to proteins and lipids in the body. This results in the formation of AGEs, advanced glycation end products, which accumulate in the walls of blood vessels. These AGEs cause the blood vessels to become stiffer, making it harder for blood to flow properly, which increases the risk of atherosclerosis. This condition, where plaque builds up in the arteries, narrows the blood vessels and reduces the blood supply to the organs. This increases the likelihood of heart attacks, strokes, and other cardiovascular issues. In addition, high blood sugar also causes inflammation. The body responds to high glucose levels by producing pro-inflammatory cytokines, which increase inflammation in the blood vessels. This inflammation damages the blood vessel linings, making them more prone to plaque buildup and increasing the risk of heart disease and high blood pressure. In addition to glycation and inflammation, insulin resistance plays a critical role in cardiovascular disease. When the body becomes resistant to insulin, the pancreas produces more of it to compensate. This leads to higher levels of insulin in the blood, which promotes fat storage, particularly around the abdomen. This extra fat increases the risk of high blood pressure and heart disease. Insulin resistance is often linked to metabolic syndrome, a combination of high blood sugar, high blood pressure, high cholesterol, and obesity, all factors that contribute to heart disease. Another key factor is cholesterol imbalance. Diabetics often experience elevated triglycerides, low HDL, good cholesterol, and high LDL, bad cholesterol. This imbalance contributes to atherosclerosis, which increases the risk of cardiovascular events like heart attacks and strokes. The imbalance in cholesterol levels makes the blood vessels more prone to plaque buildup, further restricting blood flow and leading to long-term heart problems. Diabetic nephropathy, or kidney disease, is another common complication. In the United States, approximately 30% to 40% of individuals with diabetes develop diabetic nephropathy. Globally, diabetic kidney disease is the leading cause of chronic kidney disease and end-stage kidney disease, accounting for about 50% of cases. So it's the second most important complication on our list. When blood sugar is consistently high, it leads to the accumulation of AGEs in the kidneys, particularly in the glomeruli, which are the blood vessels responsible for filtering waste. These AGEs cause the kidney blood vessels to stiffen, impairing their ability to filter blood and waste efficiently. Over time, this leads to kidney failure if untreated. In the early stages, microalbuminuria, small amounts of protein in the urine, can be a warning sign of kidney damage. And if left untreated, it progresses to macroalbuminuria, which signifies more severe kidney damage. High blood pressure, which is common among diabetics, adds additional strain to the kidneys, accelerating the damage. This creates a vicious cycle where kidney damage raises blood pressure, and high blood pressure accelerates kidney damage. Nerve damage, or diabetic neuropathy, is another significant issue for diabetics. In type 1 diabetics, approximately 28.7% develop diabetic neuropathy. For those with type 2 diabetes, the prevalence is higher, with about 50.7% affected. Distal symmetric polyneuropathy, DSPN, is the most common form, accounting for the majority of cases. Overall, studies indicate that 30% to 50% of individuals with diabetes experience some form of neuropathy. In most cases, patients are asymptomatic, and symptoms may not manifest until the condition is advanced. Things start the same as for heart and kidney disease. Prolonged high blood sugar leads to the accumulation of ages around nerves, causing inflammation and oxidative stress. This damages the protective myelin sheath around nerves, slowing nerve signals and leading to symptoms like pain, tingling, and numbness, especially in the hands and feet. Over time, this damage can cause muscle weakness, loss of sensation in the feet, and difficulty detecting injuries, increasing the risk of foot ulcers and infections. Diabetic neuropathy can also affect the autonomic nervous system, causing issues such as digestive problems, urinary issues, and sexual dysfunction. Another complication of diabetes is diabetic retinopathy, DR, which affects the blood vessels in the retina of the eye. In the United States, as of 2021, an estimated 9.6 million people, 26.43% of those with diabetes, were living with DR. For 40 to 64 years of age, the prevalence is approximately 27.15%, while those aged 80 years and older have a prevalence of about 24.81%. High blood sugar can damage these vessels, causing them to leak or become blocked. This damage begins with non-proliferative diabetic retinopathy, NPDR, where blood vessels weaken and leak fluid into the retina, causing swelling. Over time, this can progress to proliferative diabetic retinopathy, PDR, where new fragile blood vessels form in the retina. These new vessels are prone to bleeding and can lead to retinal detachment, causing permanent vision loss. High blood pressure and high cholesterol worsen diabetic retinopathy by further stressing the blood vessels in the retina. Foot problems are a major concern for diabetics, especially due to nerve damage and poor circulation. High blood sugar leads to peripheral neuropathy, causing a loss of sensation in the feet, which makes it difficult to feel injuries. Poor circulation due to atherosclerosis further reduces blood flow to the feet, making it harder for wounds to heal. Even minor cuts or blisters can develop into serious foot ulcers, which, if left untreated, can lead to infection, gangrene, or amputation. Regular foot care, including checking for cuts or blisters, is essential to prevent complications. Cognitive decline is another significant issue. High blood sugar levels over time are associated with brain shrinkage, especially in areas related to memory and learning. Diabetes accelerates oxidative stress and inflammation, which can damage brain cells. As a result, diabetics are at an increased risk of dementia, particularly Alzheimer's disease. Research has shown that chronic high blood sugar, along with insulin resistance, reduces the brain's ability to use glucose effectively, contributing to neurodegeneration. Additionally, the damage to small blood vessels in the brain leads to reduced blood flow, further exacerbating cognitive decline. Diabetics are also more prone to infections due to weakened immune function and poor circulation. High blood glucose impairs the production of immune cells, making it harder for the body to fight infections. Elevated glucose levels also create a favorable environment for bacteria and fungi, increasing the risk of urinary tract infections, skin infections, and lung infections. Furthermore, high blood sugar can delay wound healing, making infections harder to treat and more likely to spread. Skin problems, such as dry skin, itching, fungal infections, and poor wound healing, are common for diabetics. High blood sugar reduces the skin's ability to retain moisture, leading to dryness and cracking. Fungal infections, such as yeast infections and athlete's foot, are more common in diabetics, particularly in areas prone to moisture. Poor circulation also reduces the skin's ability to repair itself, causing cuts, bruises, and abrasions to heal more slowly. Each of these complications develops because of chronic high blood sugar, insulin resistance, poor circulation, and inflammation, which affect various organs and systems in the body. Understanding how these processes work is crucial for taking the necessary steps to reduce or prevent these complications. Tip to manage diabetic complications. Now let's talk about the top 5 important steps you should follow. Research shows that proactive steps can significantly reduce the risk of complications like cardiovascular disease, kidney damage, neuropathy, and retinopathy. Let's break down the preventive measures supported by research data. 1. Control blood sugar. The most important preventive measure is tight blood sugar control. According to the DCCT, Diabetes Control and Complications Trial, maintaining tight blood sugar control can reduce the risk of complications significantly. The study found that for every 1% reduction in HbA1c, the risk of microvascular complications, like kidney disease and neuropathy, is reduced by 37%. For cardiovascular events, the risk decreases by 14% for each 1% reduction in HbA1c. Keeping blood sugar levels within the target range reduces glycation, preventing the buildup of ages that damage blood vessels, nerves, and organs. The UKPDS, United Kingdom Prospective Diabetes Study, also showed that intensive blood glucose control reduces the long-term risk of diabetes-related complications by 21%. To effectively manage blood sugar, it's recommended to regularly monitor your blood glucose levels, adjust medications as necessary, and stick to a low glycemic index (GI) diet. The Diabetes Prevention Program, DPP, also demonstrated that lifestyle changes, including weight loss and regular exercise, helped participants reduce their risk of type 2 diabetes by 58%. 2. Heart-healthy diet. A heart-healthy diet is essential for managing blood sugar and preventing cardiovascular complications. Research supports the role of a high-fiber, low-GI diet in improving both blood sugar levels and cholesterol profiles. The Nurses' Health Study found that a high-fiber diet significantly reduced the risk of heart disease in women with diabetes. Foods like whole grains, vegetables, legumes, and fruits help regulate blood sugar levels and lower cholesterol. Consuming healthy fats, particularly omega-3 fatty acids, plays a vital role in preventing cardiovascular disease. The SIRT1 gene in the body, which is activated by omega-3s, has been shown to reduce inflammation and oxidative stress, both of which contribute to heart disease. The Framingham Heart Study found that omega-3 fatty acids reduce the risk of cardiovascular events, lower triglyceride levels by 30%, and improve heart health by reducing plaque buildup in arteries. A study published in JAMA Internal Medicine showed that a Mediterranean-style diet, rich in healthy fats from olive oil, nuts, and fatty fish, improves insulin sensitivity and reduces the risk of cardiovascular disease in diabetics. It also significantly lowers LDL cholesterol, a major contributor to heart disease. In terms of blood pressure, a study in hypertension research found that a diet high in potassium, from leafy greens and bananas, significantly lowers blood pressure, reducing the risk of strokes and heart attacks. 3. Exercise. Regular physical activity is one of the most effective ways to manage blood sugar, reduce cholesterol, and improve heart health. Research supports the idea that exercise improves insulin sensitivity, reduces inflammation, and helps manage weight. According to the American Diabetes Association, ADA, aerobic exercise, such as walking, swimming, or cycling, helps lower blood sugar levels and improve cardiovascular function. In fact, a study in the Diabetes Care Journal found that 150 minutes of moderate intensity exercise per week can reduce HbA1c levels by 0.7% to 1%. Exercise helps with weight management, which is crucial for diabetics. The Look Ahead study, Action for Health and Diabetes, showed that weight loss of just 5% to 10% of body weight can significantly improve blood sugar control and reduce the risk of complications. Exercise also improves blood circulation and reduces the risk of plaque buildup in arteries, lowering the risk of heart disease and stroke. Strength training combined with aerobic exercise has shown additional benefits, including reduced insulin resistance and lower blood pressure. 4. Managing cholesterol and blood pressure. Controlling cholesterol levels is essential for preventing cardiovascular disease. According to the ATP3 Adult Treatment Panel, 3 guidelines, maintaining low LDL cholesterol levels and high HDL cholesterol levels reduces the risk of atherosclerosis and heart disease. A high-fiber diet, including soluble fiber, found in oats, beans, and fruits, helps lower LDL cholesterol. A study in the American Journal of Clinical Nutrition found that soluble fiber reduced LDL cholesterol by 5% to 10% in patients with diabetes. For diabetics, statins are commonly prescribed to lower LDL cholesterol and reduce the risk of cardiovascular complications. The all-hat, antihypertensive and lipid-lowering treatment to prevent heart attack trial found that statins significantly reduce the risk of heart attack and stroke in diabetics, showing a 30% reduction in heart attack and a 25% reduction in stroke in patients with type 2 diabetes. Blood pressure control is also crucial for preventing complications. Studies show that high blood pressure increases the risk of kidney disease, heart disease, and stroke in diabetics. The hypertension and diabetes studies showed that lowering blood pressure to less than 140/90 millimeters of mercury reduces the risk of diabetic nephropathy and cardiovascular events. The American College of Cardiology recommends the use of ACE inhibitors and ARBs for diabetics with hypertension to reduce protein leakage in urine and prevent kidney damage. 5. Monitoring and regular checkups. Regular health checkups are essential for preventing complications. Blood sugar monitoring is critical, as consistent glucose testing allows for adjustments to insulin or oral medications and helps keep blood sugar levels in check. Studies show that continuous glucose monitoring, CGM systems, can help reduce A1C levels by 0.5% to 1%, improving long-term blood sugar control. Cholesterol checks should be part of your routine, and research shows that statins reduce the risk of heart disease by 20% to 30% in diabetics with high cholesterol. Blood pressure monitoring should also be done regularly. The JNC8 guidelines recommend keeping blood pressure under 140/90 millimeters of mercury, as uncontrolled blood pressure can accelerate complications like kidney disease and retinopathy. Foot exams are crucial for diabetics since nerve damage and poor circulation can make it difficult to detect injuries. Early detection of foot ulcers can prevent infections and amputations. Dilated eye exams should be done annually to monitor for diabetic retinopathy. A study in diabetes care found that regular eye exams significantly reduce the risk of vision loss from retinopathy. By consistently following these preventive measures, you can significantly reduce the risk of complications. Now let's talk about an extra tip most of the doctor won't tell you about. Extra tip: diabetics often face nutrient deficiencies due to prolonged high blood sugar, poor diet, and medications that interfere with nutrient absorption. Some of the most common deficiencies are in vitamin D, B12, magnesium, and omega-3 fatty acids. Studies show that over 50% of diabetics may have low vitamin D levels. Vitamin D is crucial for insulin sensitivity and glucose metabolism, so when it's deficient, insulin function can become impaired, making blood sugar harder to manage. Vitamin B12 deficiency is particularly common in those taking metformin, a medication used for type 2 diabetes. Low B12 levels can lead to neuropathy, which results in symptoms like numbness, tingling, and pain in the feet and hands. It's important to monitor B12 levels and supplement when necessary, especially for those on long-term metformin use. Magnesium deficiency is also widespread, affecting up to 40% of diabetics. Magnesium plays a key role in over 300 enzymatic processes, including the regulation of blood sugar, insulin sensitivity, and nerve and heart health. Low magnesium can worsen insulin resistance, increasing the risk of cardiovascular disease and further complicating blood sugar management. Omega-3 fatty acids, particularly EPA and DHA, are essential fats for reducing inflammation and managing chronic conditions associated with diabetes. Unfortunately, many diabetics have an omega-3 deficiency because their diet lacks fatty fish or plant-based sources like flax seeds and chia seeds. Omega-3 deficiency has been linked to worsened cardiovascular health, insulin resistance, and increased oxidative stress. To overcome these deficiencies, dietary changes and supplementation are key. For vitamin D, increasing exposure to sunlight, eating fortified foods, and taking vitamin D supplements can help raise levels. B12 deficiency can be addressed by B12 supplements or consuming fortified foods. For magnesium, foods like leafy greens, nuts, seeds, and whole grains are rich sources. Magnesium supplements are also helpful. To improve omega-3 intake, incorporating fatty fish, salmon, mackerel, and sardines, into the diet or using plant-based sources like flax seeds and chia seeds can boost omega-3 levels. If needed, omega-3 supplements such as fish oil or algal oil can further support intake. Regular blood tests are essential to monitor these deficiencies, as they can provide insight into which nutrients need to be replenished. Tight blood sugar management also helps improve nutrient absorption, preventing deficiencies from getting worse and reducing the risks of complications linked to diabetes. By addressing these deficiencies, diabetics can better manage their health and improve their quality of life. Research supports the fact that controlling blood sugar, managing cholesterol and blood pressure, exercising regularly, maintaining a healthy weight, and taking supplements for deficiencies can dramatically improve your quality of life and reduce the long-term effects of diabetes.